Hey there, I'm Dayna Johnson, dental practice management expert, certified Dentrix trainer, and founder of Navoni, revolutionizing the dental industry through innovation and strategic leadership. It wasn't long ago that I lived in your shoes, navigating the daily challenges of managing a dental practice with the hopes and dreams of having a productive schedule, money in the bank, and getting home on time to my sweet daughter. After 25 years working in the dental practice and 17 years as a certified Dentrix trainer, I found my life's work, helping dental teams one-on-one, optimizing their systems and software. If you are looking to create the thriving dental practice you have always dreamed of and empower your high-performing dental team, you are in the right place. Let's get started.
Hey, welcome, my friends. And this podcast is for your hygienists. So if you are an admin team member typically listening to my podcast, then make sure that you let all your hygienists and your doctors know that today's episode is all about perio charting. And so a couple weeks ago, I kind of tipped my hat that there was a new bleeding all button. And we talked all about the bleeding all button and how to make it work and make sure that you have the update and everything about the bleeding all button in the perio chart. Today, I just want to expand a little bit more about perio charting, keyboard shortcuts, how to create a customized script, how to engage your patients with the graphical chart, how to compare your historical information in the perio chart, and how to copy the information into the clinical note. So this podcast is going to be all about the Dentrix perio charting and how your hygienist can make it as efficient, comprehensive as possible. So I remember when I was working with a practice, I think it was in the state of Georgia. I think it was in Augusta, Georgia, working with a dental practice. And I remember that when I first did my initial assessment with this practice, because I was going in for an in-office session. So whenever I do an in-office session, I always do a practice assessment where I remote into the software and I look around at your systems and your reports and things like that. Well, I could not for the life of me find a perio chart anywhere in Dentrix. So my thought was, well, they must still be doing all their perio charts on paper. So when I got to the practice, I brought this topic up. And in fact, the hygienists were like, well, we just don't have time to perio chart. And I'm like, well, that's not an option because perio charting is a diagnostic task that enables you to diagnose periodontal disease or analyze the health of your patient's health, perio health. And I said, not doing a perio chart is not an option. It's not negotiable. And so, we have these conversations like the hygienists were like, well, how do you expect us to get it done? I'm like, well, you need to figure it out. So, we worked through a couple things. Now, it turns out that the hygienists were doing some of the administrative tasks that we could take out of the hygiene visit and push that back to the administrative team. For example, the hygienists were, and I do feel like hygienists should post set complete and schedule the next visit. I do believe you should be able to do that. But in order for these hygienists to feel like they had time to do their perio charts, we ended up having them not schedule the next visit and do the perio exams instead. I mean, that is a much more important task, so. But the point is that it's like you have to make time to do your diagnostics. And so today, what I want to focus on is making the perio exam, the perio charting, as efficient and comprehensive as possible. So today, I want to go through with you some of the key quick tips, keyboard shortcuts when you are perio charting. So the first thing is when you open the perio chart. Now, not every hygienist charts the same way. You might be a left-handed hygienist, and you don't start from tooth number 1 on the facial and go to 16 and then drop down to the lingual of 16 and go back. You might not perio chart that way. And so in order to make it more efficient for you, whether you're a left-handed hygienist or whether you just want to do it differently because it's more efficient for you, we can create custom perio scripts for you. So in the Dentrix perio chart, you can go to the setup, into the entry settings, and you can create a custom script. So that is one thing that could make the perio exam much more efficient for you. Now, you could also create a custom script that would be just for one quadrant at a time. So maybe you want a custom script that goes from 1 to 8 and then drops to the lingual of 8 and then goes back to 1. And then, so you're just doing one quadrant at a time. You could create a custom script for that, for each quadrant. It's totally doable. And so that's one thing that could make your perio charting much more efficient. And then the other thing that I really like about the perio charting is that there are lots of keyboard shortcuts. Okay, I'm going to go through those with you right now. But if you want to write, if you're in a position where you could write them down, feel free to do that. But if you want, you can request a copy of my tip sheet. I have it all laid out in a tip sheet, and I will leave the URL in the show notes so that you can just click on the URL to request a copy of the tip sheet of these keyboard shortcuts. So then you don't have to remember, you don't have to write them down. You can just request my tip sheet, and then you can print it out at your own pleasure. And then you could have a printout of these keyboard shortcuts. So I'm going to go through them with you right now. So as you're perio charting, so you're doing, 3, 2, 3, 3, 2, 3, 3, 2, 3. And then if you want to do bleeding as you go, then you can always use the B on the keyboard. So one thing that you'll notice when you're perio charting is that the bleeding and the suppuration, the little script box, the navigation box is always one site behind where you have probed. So once you've probed the site, then if there's bleeding, then you can use the B on the keyboard for bleeding. You can use the S on the keyboard for pus. Okay, so that's a keyboard shortcut if you do want to use add bleeding as you go along. Now, the other thing is if you are not yet up to 24.23, I think is when they came out with the bleeding all button. If you're not quite up to that Dentrix version yet, you don't have the bleeding all button yet, then you might have to use the B on the keyboard and your arrow keys to get bleeding all over. That was our workaround when we didn't have the bleeding all button yet. So the B on the keyboard for bleeding, S on the keyboard for suppuration or pus. Okay, then another keyboard shortcut as you're going along is if you want to add a furcation. So if you're in a position where you're on the tooth and you want to add the furcation, you can use the F on the keyboard for furcations. Once you click the F on the keyboard for the furcation, then it's going to list you the furcation grades. So 0, 1, 2, 3, and 4. So then you can use the number on the keyboard for the furcation grade. So if it's a through furcation, soft tissue, you can use a 3 for your grade. Okay, so that's a keyboard shortcut that you can use for furcations. Another keyboard shortcut is for bone loss. Okay, so you can use the L on the keyboard for bone loss. You can use the M on the keyboard for mobility. And then as soon as you click on the M or the L, then there's a grade listing. So 0 through 4 for mobility. So I could say, okay, there's a 3 mobility. And now the L on the keyboard is 0 through 3. So you could have 0 is none, 1 is mild, 2 is moderate, and 3 is severe. So you could put in the grades as you're using those keyboard shortcuts. And then the final keyboard shortcut for the tooth is plaque. So you can use the P on the keyboard for plaque. And then there's also a grade listing, 0 for none, 1 for light, 2 for moderate, and 3 for heavy. All right. I know this is kind of boring for you if you're not a hygienist, but I'm just wanting to let you know about all these great keyboard shortcuts because a lot of people love to use the keyboard as their perio charting, going along with their perio charting. Okay, perfect. So as you go through, then you can also, as you're going along and you're doing numbers, of course, you can continue to use the B on the keyboard for bleeding and the S on the keyboard for suppuration. Okay, beautiful. Now, another thing that you'll notice with using the keyboard is over on the right side of your keyboard of your perio chart, there is that data entry panel. So the data entry panel is a place where you can document a lot of like just clinical descriptions or symptoms observations that you're seeing throughout the mouth. So if you're on that data entry panel, click over to the exam information. This is where you're going to find things like gingiva, so like the color, the margins, the texture, things like that. So if you're over in the perio gingiva section, you could go over to the color, and then there's a drop down menu where you could select the color like pink, red, magenta, light, dark, things like that. Now, these are all hard coded into the Dentrix perio chart, so it's not like you'd be able to change it to something that you want. It's all hard coded in the system, but there is a drop down menu here. Now, the thing that I like about this is that once you have selected some of the gingiva details about this patient, then you'll also have some information about calculus. Like there's a calculus, light, moderate, heavy. There's plaque, light, moderate, heavy. And then stain is also, there's light, moderate, heavy. Now, typically, I teach my practices to build these types of details into the clinical note. And I'm not steering away from that. I do recommend that all of this information gets built into your clinical note template. However, I feel like I'm doing you a disservice if I don't talk about the information that you have available in your perio exam, because if you are sending a perio chart to an insurance company for insurance compensation for, let's say, scaling and rip planing or perio maintenance, then this exam information that's included on the perio chart can be included in the documentation that you send to the insurance company. So another thing that you'll find in the exam information section is also the stages and the grades. Okay, so I've received a couple questions from some doctors lately about where do I document the stage and the grade? Now, the exam information still has the old settings of the periodontal classifications. Now, like the old 1980s classifications are still there, but they have updated the stage and the grade. So if you scroll down in that exam information panel, probably down to about the middle of the page, there is a form of periodontitis. There's periodontitis, and then there's a whole list here. But then you'll also notice there's a drop-down menu for the stage, and then there's a drop-down menu for the grade. Okay, so this is where you could add the stage and the grade to your Perio chart. So when you do send a Perio chart as an attachment to an insurance company, they have that information available. Now, there's also some new health factors and risk factors. So if you scroll down a little bit farther past the stage and grades, you'll notice there's risk factors like smoking and tobacco use.
Did you know that you could increase your team's productivity by up to 200% if you had a formal team training program in place? And businesses that do have a formal team training program in place also enjoy up to a 24% increase in profit margin. If you want to learn how and book a call with me, click on the show notes and book a free discovery call with me, and we will talk all about it.
So you'll notice that there's also some health factors like HbA1c, if it's 7% or 7% or higher. There's also dry mouth, or there's other. So then you can type in your clinical note if there's a health factor that's other. So these are all available. Then there's also a miscellaneous note box if you want to type in some other information. Now, the important thing to remember is that this exam information does connect itself to this Perio exam with this date, okay? Now, once you're done with the Perio charting, all the probing numbers and all of that, and your bleeding, your suppuration, your pus, your mobility, all of that, and the exam information, now what you can do is you'll notice that there is a, at the very top of the exam information panel, in the upper right corner, there's a copy exam information to clipboard. Okay, if you click on this copy to clipboard, then open up your clinical note and paste into your clinical note. All right, now I'd love to get some feedback on what you think of this, because not a lot of hygienists know that that's available. And so it can be very efficient. It could be very comprehensive for you to copy that exam information into your clinical note, and then you could just fill in more of the details. Okay. Now, you might like that better than having a clinical note template. I'm not sure, but I want to give you that option. I feel like it's my responsibility to tell you all of these amazing things that your Dentrix software can do for you. And I want to make sure that you have all the details, all the information, and that you are in the know. All right. Okay, my friends, I hope that these keyboard shortcuts, the exam information panel, and the bleeding all button has been really helpful for your hygienist. Now, we might dive into the Perio chart in a little bit more detail in the next upcoming weeks, so stay tuned. Now, I look forward to watching your journey of becoming a high-performing dental team.